week is Dementia Awareness Week, and this is a short video by the Adult Rehab Special Interest Group, ARIG, and the Cognition and Hearing Special Interest Group. And it's to raise awareness of dementia in a clinical setting. The symptoms and impact of dementia on a person are varied and unique. People live their lives with dementia and they continue to be a mother, a son, a carer, a colleague. By understanding dementia, everyone can help make adaptations to support people to live the life they choose. Audiologists have a huge role in making services accessible and suitable for people with dementia. As many as 87% of adults living with dementia may also have hearing problems. The VIPS model is often used to guide clinical care. Valuing people, seeing the individual, looking at the world from their perspective, and having a social environment that supports them. But we practice patient-centred care for all our patients, so what's different for adults with dementia and their families? The impact of dementia and hearing on communication overlaps and is magnified. If we treat the hearing loss, the person will have the best chance of communication, independence, and an improved quality of life. Communication also relates to consent, capacity, and shared decision-making, which is vital in healthcare. An adult with dementia has periods of change. This can be during the diagnosis, the progression, and their care needs will also change. And that means the person and their family need supportive and flexible and understanding healthcare professionals. Audiology services for adults living with dementia and their families are built around the person. Adaptations can be made at each step. During triage and preparation, asking people what they need, making contact with them once the referral is received, ensuring that people are booked into suitable clinics with appropriately trained staff on a day and a time that suits them, making sure information is accessible, helping the person to understand what will happen before they come, what to expect. Self-report can be quite difficult or stressful for a person living with dementia, so sending the history questions in advance can give people a chance to think about their answers. Planning the pathway to suit the person can be useful. Some people may need shorter, more frequent visits, but others may benefit from longer, fewer visits. Having a comfortable environment where the person feels safe will be extremely beneficial in the process of assessment and management. Adapt the way that verbal and written information is provided so the person understands their options and can make a decision for themselves. Keep the family and the carer close by, make sure they're always involved in the appointment and they're nearby and visible for support and for reassurance. Many adults with dementia will experience sensitivity to noise or hyperacusis. There's been some great resources developed to support people to understand and to live with noise sensitivity. Auditory hallucinations are common for adults living with dementia. Regular hearing tests, hearing aid maintenance and support for tinnitus can help reduce the impact of hallucinations. People with dementia tend to underreport tinnitus because they don't want their tinnitus to be misconstrued as auditory hallucinations, or they may not be able to tell the difference between them. Be open and ready to talk about auditory hallucinations when discussing tinnitus. Testing can be adapted in many ways. The family, friend and carer can offer encouragement and reassurance during the testing and can be near to the person as a familiar face. Responses from this group of people tend to be verbal descriptors, high, low, or it sounds like a certain sound, or they may say yes or no, as opposed to pressing a button. So we can be flexible and accept different responses. It might be useful to gather the most important assessment information first, considering red flags, asymmetries, mixed losses. It may be useful to do fewer more accurate thresholds rather than a full PTA and no sound trials are important for accuracy. For some people, having 2 audiologists during the testing can support them and improve their experience in audiology. It means one audiologist can focus on presenting the sounds and the other can support the person to respond and help to look for the responses. This might be a senior supported by a Band 5 audiologist. Being able to test hearing in the sound field and having automatic tests of hearing means there's always a hearing test to suit everybody. If this isn't available locally, consider how pathways can be set up to neighbouring services. Informal and functional tests of hearing, such as discussing pictures or photos or responses to music, can give valuable information about a person's hearing ability. Home visits are a great way to gather information and understand how a person communicates. Taking a sound level meter is important so familiar sounds at home can be measured. Adaptations to rehab. Allowing a person to try hearing aids before they decide if they want one helps them to listen and feel with the hearing aids so they can make an informed decision. Again, when fitting the hearing aids, having 2 members of staff can be useful. So one can focus on the computer parts, the technical bit, the other one can support the person during verification. People living with dementia should be considered for all audiology services, all types of hearing aids, all types of features on an individual basis. Hearing aids may not always be the best option for a person. Adaptations to communication, the environment, lip reading, assistive listening devices, sign supported English, photo cards can all improve communication and quality of life. Home visits are useful to evaluate outcomes with hearing aids and rehab. Training for families and care staff is important. Communication training, hearing aid maintenance, how to test the hearing aids are functioning. Supporting hearing aid use in adults with dementia can often be a team approach. Developing a management plan to ensure that the hearing aids are used and available when they're needed, that they're looked after, and that the person is able to use them when they want to. Lifelong care. NICE recommends a review every 2 years. It's useful to consider calling this group back for services and maintenance, rather than them being on an open referral to come back when they think there's a problem, because it might be difficult for them to identify if there's a problem. Adaptations and flexibility in cancellation policies, non-attendance policies, lateness and lost aids can support families and people with dementia to continue to use the hearing aids and access the service. There isn't a generic pathway for people with dementia. One pathway won't fit everybody, but making adaptations at each stage in the pathway will ensure that the pathway is suitable and accessible and effective. There are many professional resources to support audiologists to provide care for adults living with dementia. There are recent guidelines that focus on the link between hearing loss and cognition, an update, and recommendations and adaptations to audiology clinics, some of which have been talked about today. These papers are open access and they're free. People with dementia will share their experiences, their lived experiences, and this can be a great training resource, a great way to understand what patients might need in your clinic and what their families might need. Here are some useful links to lived experiences. Thanks to the members of ARIG and the Cognition and Hearing SIG that contributed to this talk. If you have any comments or you want to share anything with us, please contact us on the email address shown.